Sioux Lookout First Nations Health Authority, or SLFNHA, presents SLFNHA Radio Connect, building strong connections with communities by sharing who we are, how we can help, and the services we offer. Ako Wiindamekewinan, Sioux Lookout First Nations Health Authority Gajgadig, Egochkea Eskam SLFNHA Vision Kade. Miwa Kegunenan, Iwanun Keguns Wichi Guyagban, Ima Ishkunaganang Kazagabeshig, Egochkea Iwanun SLFNHA Wiindamekewinan. Greetings. My name is Charles Mikas, and I will be your host today. I currently work in the Wiindamekewinan department at Sioux Lookout First Nation Health Authority. And I'm originally from Sandy Lake First Nation. I've been with the organization now for about 8 years. Bojo Wawatay Gadna, Hegama, Ngagakugajmawe, Oguma, Kegunenan, Iwenun, Wiindamekewinan, Imanike, Sioux Lookout First Nations Health Authority. Welcome to today's program. We're excited to have Trish Hancharek from SLFNHA. She is here to speak about Noden Mental Health Services. Kiiwetinoong Bojo Wawatay Maujaganumanendamin ma eawangaj ewi kagidid Trish Hancharek ego ahin gawi anamodang ahin Noden Mental Health Services miwanun kagaganun wenanung ako.
Miigwech for having me. I'm very happy to be sharing with you today.
Thank you, Guy Yaushian. Mawad Nukstine Chiwindamekewinan Kegon, Nongom Gagizugak.
Before we start, please tell us about yourself and your history with SLFNHA. Ego mima gadawin demosnamna gadan khuyunu egab modoin ahing SLFNHA gayan khuyen.
Sure. A bit about me. I have over 25 years of experience in mental health, addictions, justice, and community services in Ontario, with the majority of my career spent working with First Nations in our region. My husband, Ben Hancharek, and I are both from Sioux Lookout, which is why we love living and working in the north. My career has focused on helping people through counseling, applying my expertise in addictions and mental health, and supporting others to do this important work in our northern communities. I have been the Director of Noden Mental Health Services since May 24th, 2016, and that's 9.5 years, managing the department and ensuring all services provided to the First Nations served by SLFNHA are offered with kindness and care. I have worked with SLFNHA for a total of 12.2 years, beginning as a manager in the Regional Wellness Response Program, where a team I managed supported First Nation communities in the SLFNHA region to address opioid addiction and related harms. Earlier in my career, I worked with high-risk pregnant and parenting women through Breaking the Cycle, Mothercraft in Toronto, and then for 9 years as a counselor at the Wiindamekewinan Health Centre, supporting First Nation clients and other individuals with a wide range of mental health and addiction needs, including high-risk and vulnerable people in shelters, involved with the criminal justice system, or from Northern First Nation communities stuck in Sioux Lookout due to complex challenges. I also worked briefly as a probation and parole officer and gained early experience in the funeral service.
Gechinat, Panginin Unche, Awashime Nishdana Nyanan Jabakke, Umambetune Chigani Kiiwetinoong. Maskikikewa Pinewanan, Onahkunagewinan, Minaga Motanukawan Iskunagan, Mistahinekiwitanokimagan Sinwag Huednekekamik, Nenapim Ben Hancharek, Mike Nin Ohuma Wananawangang, Mi Wenjisak Toyank, Kiiwetinoong Chikabeshyang Mina Chiankiang. Niwi Chahag Awiyag, Ema Mina Magwah, Ihabatstuan, Nink Kentamawan, Omashkikewa Pine Mina, Omametunen Chikananga Ahkusich, Mina Ehuichagwa Kutagiak Awiyag, Kagchi. Anukiwat Kiiwetinoong. Homa Nendogimau Northern Mental Health Services, Northern Wiindamekewinan, on May 24, 2016, sangas yakminapta akke. Bimo wetoyan anokiwen mina kitchenat anishinawaka anoka gut SLFNHA. Kitte maken nimwewening mina pekat. SLFNHA ninki anokawa ni so sabakemina ni so kides eki Wiindamekewinan Regional Wellness Response Program. Nawi tanuki maganak ninki Wiindamekewinan Ishkunikanak eki wakawinundamuat maskikikewapinewen mina kasi matsipinagoat. Kape matanukian ninki Wiindamekewinak eka ito kekikishe kikiskawasut mina ka onichan swat asa ikwewag unche Breaking the Cycle Mothercraft in Toronto midas shangasu ake ninki maminamue Minyuyawan Health Center ewid shagwa udakosik mesueka inapnewat umame tune chikanawang mina umaski kewa pnewang kaye eka koya kaki kanawen minch mina kitma kasiw kami kong kakapeswat kipahotiw kami kong ka isasewat nanda Kiiwetinoong ehwenchit homa ene pitse hot ehanemset. Mina atina ningianoki probation egaga kipahikan which umamani. Mina parole officer aptaga kipahunch apingazi bagitanench kipahagan mina wipach ningi kendan na hatsigewin.
At Sioux Lookout First Nations Health Authority, we're committed to building strong, supportive teams, and we focus on hiring First Nation employees wherever possible. Whether you're just starting out or looking for a career change, SLFNHA offers competitive wages, comprehensive health benefits, a pension plan, and even fitness reimbursement. Visit www.slfna.com/careers to explore current opportunities. SLFNHA, health careers grow here.
That's great. Thank you so much for sharing. Can you please tell us about Node and Mental Health Services and its role with SLFNHA in the communities they serve? Mia maujuga mamuntawa niwe Wiindamekewinan siang, Wiindamekewinan kabizindamwaj. Ego Wiindamekewinan namna gegunin mayamiwe Node and Mental Health Services. Ego chke ima kazuid segima SLFNHA gajgadege gochke anin meaminan huaj kawichi hawaj wed Kiiwetinoong kaunjinj.
At Noden, we have several services, and I will name and describe a bit about each one. So we have an intake and assessment service, and that is a centralized unit that receives referrals from service partners or self-referrals from individuals, gathers essential information, screens and assesses needs, and connects clients to the most suitable mental health service. The team also helps coordinate travel for clients from northern communities to access services in Sioux Lookout. We also have an outpatient mental health service, which is a 5-day service in Sioux Lookout for children and youth from First Nation communities. Clients meet with clinical staff once per day over 5 days. The service helps youth address underlying trauma, prevent or reduce high-risk behaviors like self-harm or substance use, and develop coping skills to improve overall wellness. Priority is given to children and youth, while adults may also be seen when appropriate. We also have a psychology service, which provides specialized assessments and therapy for children and youth with complex mental health needs. Adults may also be seen, but priority referrals are for children and youth. We have school-based youth counseling, which supports First Nations youth from northern communities attending Sioux North High School in Sioux. It helps students adjust to high school, develop coping and self-regulation skills, maintain emotional wellness, and connect with mental health and cultural supports. We have traveling counselors who provide ongoing culturally sensitive mental health support directly in First Nation communities that SLFNHA serves. Each counselor rotates between 2 communities each to ensure consistent, predictable care and remains in communities for 5 days. We have a mobile outreach service which supports vulnerable individuals in Sioux who are experiencing mental health or addiction challenges, including those who are homeless, staying in shelters, or in crisis. Provides crisis support, case management, advocacy, and harm reduction, and helps individuals reconnect with their home First Nations communities when desired. We also have a social emergency response service, which provides rapid, short-term, culturally grounded support for First Nations communities experiencing crisis or social emergencies such as tragic deaths, suicide clusters, community violence, or missing persons. NODAN responds only when a community requests support. The service can deploy contract crisis workers, which means mental health counselors and or cultural workers, or pay for volunteer crisis teams from neighboring communities to travel to the community in crisis, covering their flights, accommodations, and meals. Communities can also organize their own volunteer crisis teams using local members, with NODAN covering per diem costs for those volunteers. NODAN works very closely with other SLFNHA departments using an incident management structure and works with other regional partners, including tribal councils, NANHOPE, community crisis coordinators, leadership, etc., to ensure there is a coordinated response. Regarding the community-based children's mental health and addiction workers, some First Nations have these workers who live in their First Nation communities to support children and youth under 18. These positions provide emotional support, basic mental health guidance, crisis response, and connections to higher-level services using culturally grounded approaches. Some are managed directly by the communities on a contract for service basis, with NODAN flowing the funding. NODAN hopes to expand this model to all communities. In addition, NODAN provides the mental health component for the Kiiwetinoong Return to Wellness Holistic Family Camp. This SLFNHA-run camp supports families, children, and youth in a safe, culturally grounded environment, integrating mental health counseling with traditional teachings, land-based learning, and family strengthening activities. The camp promotes emotional resilience, cultural connection, and stronger family relationships, offering a holistic approach to wellness that combines mental health and cultural support.
Huma noten, Wiindamekewinan, mina ninga Wiindanan, mina ninga unchikit bangi kegunenwak. Wiindamen, bintike bihkewen, mina dananta wen nimewewen. Wichiwewen ka Papinchenes ahwaz otakus siman. Eskunaganung nanda win wenne dank maskikiwenen wan we wabamach. Mawan tonang otesyayawanin. Kutsahat mina katawenimat. Mina esisinizahuat. Omame tunne chikanenin kesi withiminch. Anohkina kanak owithawan otahkosin Kiiwetinoong wananagang tisanet. Dayamen ega maskakiwe kamikong tse pimising nanakatsahinch omametunechikaning otahkosi niana nokisika chwit hinto apinoti sak mina uskatasak Kiiwetinoong ka unjiwat otahkosi okawapaman anukina kanan Pesiko kisika is niana no kisika. Wichiha oskatis chikano tank. Ogechina pinenekowen. Che nisenekatek nantaka tutasuch. Nantaka minekwech. Ka maskikech mina che onentang wahtotang ega che ozamentang. Ni kane nemawak abnonji shakmina oskatasak. Ka kisikwach kayetaki wapamawak is senik. Dayaman Mametune chigan wheat hiwewen. Ka wheat hawaj abnoti shanmina uskatasan mawaj ka animak. Mametune chigan ahkusuan. Ka kisikwaj kayetakiwapa mawak. Sa goch abnoti shakmina uskatasak nikane mawak. Dayaman. Iskoniwa kami kong oskatis mamina muwewen. Wich hinto ke Kiiwetinoong o deskonik wananawan kang kabisawat. Wich hint o deskoni chisa kakentang o deskoniwan. Che onentang Wahto tang ega che unzamentang che peyahtakenemoch mina omametunechigan mina otanishinaniwate sawaneng chise wichihinch. Dayaman ka papamiyawach omaminamuwek. Kawit shawaj anshinawan abuning. Kakina omami namuwek. Mami squatskawak. Nishin abuning. Kichinach kwayak. Chiwich hinto. Niana no kishika. Ayawak abuning. Dayaman nanantunagewi chiwewan. Wich higowinawa o Wiindamekewinan wananawangang umametune chikaning mina abat chigewa pinewanika anim sahigowach kaye eka ka okapeshuwinawach Wiindamekewinan gamakong eshikapeshuwach nanda Okochanimse Nande Kuchanimsit Ka Kuchanimsenit Owichan Otishiyawin Ene Kanawen Chikatenik Kano Ïhtsamakewinan Egache wisaka hotesut mina wijhan auyen chiki kitunet chikiwe kitunet begwanapi. Dayamen kichimat seven wakawiwen. Shemak wakawiwak additionniwe ïềhétaᒪʲeinan ehabats kagchi is sekekon. Tabskut auyaka niput ka okko nisitwach auyak. Abeweneng mi kasoen nanda auyaka 1 inch. Noten isa esta abeweneng kape kanonens. Utaki isinisahuan ka tibahamawa winch ka tibahamawa minch anhukinaganan. Umametunin chikan mina anisnaniwa tesiwe anhukinagan. Nanta che tibahamawan do omohtanuhkik kutaking apawaning che pisawach che tibahigatenik opemsewanwa ukapeswanwa mina ke mitwach. Apawaning Kiiwetinoong utaki unasawan omohtanuhkimuan. Noten das chitibahang utanuhkiwananin omohtanuhkin. Noten obesowidanuhkiman SLFNHA ehabats unachgewen awenen mawach kegimino wijihapan. Kutagian ga widanuhkimach tribal councils nan hope abuning chimat sewaning anuhkinaganak okamakanak kechinach chiwitanuhkimetananawak. Winawa Tashwin abiwaneng abino Jesus umamatunin chikan mina abad chikewa penewan anuhkinaganak. Anta abiwaneng utayawan anuhkinaganan eka beshenit hima ewich abinochi shan mina uskadsan ega 18 ka dasbabonenet ohuenewan anuhkiwinan wijhan enamanchhunit abinochi shan mina ïềhétaᒪɁeihnani Kichisewen wakawiwen mina ka spag wichiwewen okaki tepenan chi abad stoj anishinaniwe ïềhétaᒪʲeinan. Ananta opemewinikowan abewanan noten ïềhétaᒪʲeiwach noten ubagusendan owe chiki tu chigate kipan kahkina apawaning. Kaye noten upagitinan mametunen chikan wichiwewan Kiiwetinoong miniyawan Return to Wellness Holistic Family Camp. SLFNHA udabad stagan uwijhan tipen chikewanan. Abinochi shan mina uskatasan kesepe tagkisnet. Otenat siwananink ehkikinang mametunen chiganink Mamino Mowewinan Kaye Kete and Siniwik Kendamawan Pikwata Kiiwek Kendamawan Mina Ke Onche Maskawich Te Penchegewen To Tamowanan Kape Shiwakamik Owe Jiston Maskawe Nemowan and Shin Niwa Tesuan is Sagisink Mina Maska Wak Te Penchegewen Miswe Minuyawan Īhtsutamakewinan Kaye Mametunechigan Wichiwewan Mina and Shin Niwa Tesuan.
Could you tell us how Nodin Mental Health Services is helping build wellness in our communities? Wiindamekewinan an mayam īhtsutamaģu udankunwa Nodin Mental Health kawichihawaj Kiiwetinoong isunganang kaunjuaj.
To build wellness in your communities, it's important for you to know that Nodin has qualified registered clinical professionals that are registered under their professional body. To also build wellness, Nodin helps individuals face their challenges and work through difficult current and past situations. Nodin's staff supports people in addressing mental health concerns, substance use, and trauma. Nodin teaches healthy coping skills and fosters meaningful changes for personal wellness. The staff encourage recognition of the importance of connection to culture for improved wellness. Nodin helps individuals understand their resilience and break cycles of harmful behavior. We really try to empower children and youth and adults to move forward toward lasting wellness and well-being. And we do so much more. We will help with whatever a person wants to finally talk about in order to work through what is causing them not to feel well or to function well.
Odonche ka koyakuman Īhtsutamaģu opepanomenet okkendaman Wichan awianche nagskamenet Otanem Sewenanin Nongo Mina Otanank. Otasuscawan Awian we Kano Damenet Omametune Chigan Anem Sewenanin. Otabadgewenanin Mina Gichte Inapenewenin. Kinohamaket. Keshe wiche hittesunet egache unzamentaminit mina keshe koyak kanawene mitenit. Usagosmanche nesetawentamit anshananiwatason chuenche minoyanit. Wiche hat awianche nesetaminit she beskates a winne mina chi nasibana which majistigewining is the stage. Maskawaj hat abenoji shan oskatasan mina ga kishiganit awian menoyawanink cheese majanit. Mina gabet mistahi o gawi chihikun awiya gawi tasentang chi anoka tamawach ke gonan ekaka unje minu ayat.
Good day, everyone. My name is Dr. Lloyd Douglas, and I'm the public health physician here at the Sioux Lookout First Nations Health Authority. I want to talk to you about routine vaccinations. Our communities are strongest when we take care of each other, and that includes staying up to date with routine vaccination. Lately, diseases like measles are making a comeback in Ontario and in Manitoba and all across Canada. These illnesses spread fast, and without vaccines, they can cause serious complications, even death. But measles isn't the only concern. Other vaccine-preventable illnesses like whooping cough, mumps, or even certain types of meningitis can also threaten our health, especially for children, elders, and those with weaker immune systems. Routine immunizations help our bodies build protection before we're exposed. Vaccines are safe, tested, and free. Most are given during childhood, starting at 2 months, then continuing into school age. There are also important boosters for teens and adults, and if you missed any, it's never too late to catch up. Whether you're planning a trip, heading back to school, or just want peace of mind, now is the time to check your immunization records. Let's protect what matters most: children, elders, and your way of life. Talk to your healthcare provider or nursing station about routine immunizations. If you have questions, you can also email us at acwinfo@slfna.com. Protect our past, safeguard our future. Keep up with your routine vaccinations. This message is brought to you by the Sioux First Nations Health Authority.
What are the next steps for NODN to better support communities and deliver on strategic directions? Ego an Kiiwetinoong nigan NODN Wiindamekewinan wichiawad Kiiwetinoong anshinwagego anshinabek.
Next steps for NODN to better support communities. I think it's really important for communities, their leadership, workers, and members to have a clear understanding of NODN's services. In a region with multiple organizations, it can be very confusing to know what NODN provides, what is funded, and for what we are not funded for. I'm happy to visit communities to give presentations and explain NODN services. Soon, a new referral form with service descriptions will make it easier for people to access support, helping more individuals get the care they need. One of SLFNHA's strategic goals is service excellence. Since I have been the director, I have focused on strengthening NODN services and delivery through a range of initiatives. This includes implementing process changes and standard operating procedures to ensure consistency and quality, supporting my staff in the development of a triage process in partnership with the hospital's mental health and addiction program, and establishing an auditing program to monitor and improve service delivery. We also have developed and implemented a client satisfaction survey to gather feedback on NODN services. The results are being analyzed and used to identify areas for improvement, inform staff training, refine processes, and ensure services better meet the needs of clients. In addition, we have clarified roles and responsibilities, improved referral pathways, and enhanced staff support to ensure clients receive timely, effective, and culturally informed care. These efforts reflect our commitment to continuous improvement, and we will continue to build on this work to provide the highest standard of service for communities, their leadership, workers, and members. Please reach out anytime to arrange a community visit or presentation.
Wiindamekewinan mina anshinwagtapeihte nisiddu tamuwaj NODN enanokaguach Iehemanehke kashimsinuwaj Wiindamekewinak kawan payahte endagwasinon enanukich NODN Kegon tepahigatek, mina kegon ega tepahigatek. Wiindamekewinan Kiiwetinoong tepaatsemuyan NODN enanukich. Asa kegat uski ahkusiwe machinja huweo pepan kesi wichikuch utahkusi kekepihikate chiwanche wendak chiwichikoyan nawat machine awiyak chiwanche wichihinda basic ke kon SLFNHA ka kwe te nank mawa chimin senik wichiwewan menukoka pe okemauyan Ninki maskawaton noten wichiwewanan mina kasi pakitanank kaye dachikeyan ka tuchikatek anokiwan kichinat pesigwan Jesus sake wichiwewan wichhagwa nintanokkinaganak when mawach ka ahkusinich nistam chiwapament si witan kimetiang ahkusiwe kamik mametunen chikan kanank mina maskike wapnewen wichiwewen Mina chipeme kanawen taman chi minus seken nedona chigewenan. Ningi ojistomen mina abadstomen kagweto pepan ewi kiken taman enen tamoakwe noten utoshki unachigewen. Keye to cuentas utahkusik ante que se mami nuachiganawank anoki nakanak chiken no hamawento awashme que se mensek chinatuyan mina que chinach che mensewach utahkusik kaye Ningi payahtabihan anokiwinan che wendak machin zahuanchutahkusi mina chiwichihinch utanoki kechina chiminawich hatutahkusin mina utanata siwananing. Huwe anokiwan nagwan awasme chiminsek wichihiwewan. Mi piko kesi kawangit apuwen. Okema kinaganak mina ansinowak. Ahte pikanon sinam piguana piche unatuyan che pikiwikeyank nanta che tipachemo takuyek.
Thank you, Trish, for sharing about Node Mental Health Services. Is there any upcoming news and plans you want to share with our listeners? Kiiwetinoong iwega tadazindaman Trish. Wiindamekewinan namna anin meam Node Mental Health Services kawi biaischigajiwa is nigan. Wiindamekewinan aunugabizindamaj
Miigwech Charles, I'm just happy I was able to speak to everybody today and to explain a little bit about Node Services. I just want to say that I hope it helped for those that are listening to better understand our services and how much we really want to help community members. We are here for you. For more information about the services, you are always welcome to call 807-737-4011 and ask for the intake department. You can also reach out to me at 807-737-4011 and just ask to speak with the director. Thank you.
Thank you, Charles. Ewi kadian pagkosentaman huwech wich hikuach opesentamok te onse pai te tamawat no ten Wiindamekewinan aapetewi te hangatoa an sinanoak. Kinawa homaka wenchi ayayik. Kiabige week Kentaman Picketon 807-737-4011 Mina Kakwetuen Chikanonat Opin Chipihoe.
So that concludes today's show. Thank you for tuning in to SLFNHA Radio Connect, where we are building strong connections with communities by sharing who we are, how we can help, and the services we offer. Connect with SLFNHA on our Facebook page or on our website at www.slfna.com. Miapanugiwa etipseg noom imaga Wiindamekewinan akwazio ankyun gabmujgadig ima SLFNHA Radio Connect. Bawajugu aikadnanun ishunganan suitan humanda anshinwagega anshinabeg egotske anin gegizwichigueman iwa akwazio ankyun gabmujgadig migat.
Recorded and produced at Wawatay Communications Society.